Healthcare is a huge issue for everyone. 40,000 people are on a waiting list for a family doctor, and there is a shortage of nurses, as Donna said. Healthcare professionals who remain on the job are burning out. How would you address these issues as an MP?
I think it's very clear that I feel very strongly on this topic. For the better part of 10 years, I've had the disprivilege of working in an underfunded, under-supported healthcare system across this country. Healthcare affects us all, be it newcomers or, as I mentioned before, born citizens. And we need to make sure that we're investing and supporting the individuals in that system that are then in turn supporting us. I know we hear a lot of talk about jurisdiction and how healthcare is under the provincial jurisdiction, but the reality is jurisdiction is only an issue when we allow it to be an issue. The federal government, and should it be inclusive of me as your member of parliament, we have powers that are not currently being put pressure on. We need to make sure that, again, we are breaking down the barriers for our international nurses, our international doctors, encouraging people to come here, but to stay here. I'll tell you a little bit about a situation that I came across the other day because I think it really speaks to this question. There's a family doctor within our province who is experiencing their own healthcare issues. And because of the barriers that are put in place both provincially and federally, this individual will be leaving our province at the end of September for another province. That doesn't just happen within our provinces, it happens within our country and people leaving our country as well. Our healthcare workers across this country do not feel supported, both in the wage that they receive and the protections that are in place. Every single day in my job, I am abused both physically and mentally, and it just gets to a point where you just are completely burnt out. You lose your ability to show empathy to individuals, and that is why we're seeing a mass exodus. If I am your member of parliament, I will encourage, no, I will fight for more funding for our provincial healthcare systems to support areas like mental health, addiction, and more importantly than anything else, but the retention of healthcare workers. It is important that in order to build our healthcare system, we start from the bottom up and not from the CEOs and leadership down. We need to encourage more people to enter this workforce. We need to create more university and college institutional learnings so that we can increase the population in this workforce. And more so, we need to make sure that we are retaining people in this workforce by giving them a livable wage, by giving them the protections that they need to do the job that they're doing every single day.
So I'm going to give a different message than most politicians will ever give, and it's that you are in charge of your health. The healthcare system does not sustain your health. Your individual choices, when you open up the fridge and you see an apple and you see a cake, when you choose the apple, you're taking care of your health. When you spend 2 hours on Netflix each evening, or you go out and you use our parks and you walk and you take good, healthy choices, then our healthcare system doesn't have the burdens that it has. Of course we need to provide good healthcare here in Canada. That's an of course. At the same time, we're encouraging Canadians to stop pandering to big pharma and start taking charge of your health. Healthcare is your responsibility, and it's the government's responsibility as your member of parliament to help you get healthy. I want to change the measurement of healthcare. Not that it's getting bigger, but that it's getting smaller because Canadians are getting healthier. Thank you.
So yes, the first thing I would do as MP is I would fight for having health transfers calculated based on age of the population, not just per capita. New Brunswick has a large percentage of senior citizens, larger than a lot of provinces. And senior citizens, through no fault of their own, often use the health system more. Therefore, I believe that calculating transfer payments by age would give New Brunswick more of the badly needed funds it needs for a good running healthcare system. The other side of things is I believe that the system could use some reorganization. For example, I would like to see publicly funded, and I would fight for this as an MP, work with the province to put in place publicly funded community health care centers where there is a medical team that consists of doctors, nurse practitioners, nurses, dietitians, occupational and physiotherapists, youth workers, to name a few, that would provide health care to a community and would be the community's clinic. Thank you.